Welcome back everyone. Dr. Naveen here from UPSC MEDICO, and congratulations to all the aspirants who have made it to the next step. So when I say personality test, it is personality test, it is not interview. So many of the times if you go to the orientation sessions, they'll also tell you the same thing, repeat boring thing. It's not about your knowledge, it's all about the type of personality you are. They judge your personality, they judge your communication skills, they look at your leadership qualities, adaptability, mental alertness, and also critical thinking, way forward, what are you going to do with the policies and all. And also, very importantly, honesty is the best thing, right? So, be honest as much as you can, so that actually wins the race. Now, when we talk about personality test, on an average, I'll share the details of all the doctors who cleared last year along with their personality test marks. I could see doctors scoring in the range of 160 to 210, and in the last three consecutive years, the top two or top three range are medical graduates. Like you have 205 and also 206. Okay, in the recent past, in the last 3 years, and Dr. Anshu Priya has done really well. She scored 200 plus, and last year Dr. Nitira Priyanti also is the second topper in personality test. And when you compare it with humanitarian background, though the sample size is low, though there is a bias, medical science students are on an average scoring plus 20 marks extra. So the mere reason that you are a doctor itself, you will possess some qualities, personality, and also communication skill. That itself will put you forefront in this race, right? So on top of that, if you impress them with answers, exclusively health related answers, you will definitely fare well in this exam. Now when I say health related answers, so what is the percentage of health related questions that you see in medical science? So it varies along with the board and also how you direct them. Okay, what I personally observed is any doctor for whom the predominant, like 40% to 50% of the questions, if they are health related, they fade well. That score, average score is high. So this is my experience with almost 60 plus toppers in the last 4 to 5 years of mentoring medical science students, right? So if they're asking you health related questions, if they're interested about your medical knowledge, medical education, you being an MBBS doctor or a medical graduate itself will push you like that little extra into scoring well in the personality test. Okay, I'm not asking you to push them into that direction, but if that is going in the health direction, I had seen students scoring well, okay, with personal interaction and also the interview transcripts. What I observed, this is the subtle point I noticed. If your questions are in the health related direction, you're going to fare well in the exam. Okay, now next important thing is when I say that the three key things that you need to focus when you're going for personality test is, very importantly, majority of the questions are DAF based. Okay, and also you have to keep track of current affairs. So for that you should the importance of daily newspaper reading, right? So keep continuing that till the day of the exam. Okay, the personality test. And also very importantly, practice. The number of mock interviews varies. Sometimes if you attend too many mock interviews, you will undergo fatigue, mental fatigue and all. So try to choose ideal number of interviews. Okay, don't kind of get into mental fatigue. Okay, plan like with leisure time, at least 1 to 2 days between each mock interview, so that attending mock interview is the first important thing, but the best thing is to critically analyze that interview transcript, what went wrong, what were you doing, and also preparing ready-made answers for the questions asked in the mock interviews. So you have to do that exercise or drill post interview. That will fetch you more marks. Coming back to for medical doctors or medical graduates, see, I have to put forth a disclaimer here. So whatever I'm trying to convey, these things are experiences of doctors from last 6 years, 5 to 6 years. So I have never been to a personality test, but I have interacted with a lot of medical graduates so that I can transfer this knowledge to the budding doctors who are actually gonna attend the future interviews, right? So when I say this, on an average, they are getting around 20 to 60% of health related questions, and the most common question they feel they kind of go through is the switch. That is why from a specialty field you are entering into a general field called civil services. It's a usual question. They'll ask the same question to even an engineering graduate, a law graduate, or economic grad. Like there are various graduations. Like you might be interested in doing medicine, but what is that subtle reason or a honest reason you have decided to quit? Like India is already in a dire need of doctors, right? So why do you want to leave a noble profession and get into services? So what pushed you and all? You need a honest answer for this. And what I observed is, see, nothing looks honest most of the times, 9 out of 10 times, because IAS fares well over works out well, there's more prestige, and though on paper income is low, the respect is high for an IAS officer. So we usually choose IAS for the reason of pride most of the times, but you can't be just that brutally honest in this exam, right? So but you have to find a middle way and make sure they do not drill on this particular question. Okay, the quicker the examiner moves away from the switch question, the better it is for you, right? This is not kind of it is not about judging your personality here. They even know the darker side of why people choose IAS, right? They do interact with almost 7 to let's say they might have called around 2000 plus candidates, right? They do know that sometimes you're not honest in this, but my sincere suggestion is find a subtle reason, a reasonable reason. Okay, not to like people say that I want to serve the nation and all, because when you want to serve the nation, even medicine, you can do the same. But there are some like brutally honest aspirants who say that I didn't like medicine at all, so I want to switch and all. Don't go to the extremes. Find a middle way. Find a right answer in 2 to 3 sentences, so that the examiner should feel half-heartedly satisfied and move to the next level. So because the next level is the best level for you. Okay, so focus on the switch question, which is like 9 out of 10 times they'll ask you, because you are a medical graduate. And people are of opinion that the medical graduates, this switch question might put a negative bias and you might not score well. This is never ever considerable. Okay, because see, let's say UPSC has given an option for a specialist to choose UPSC as their career option, right? The civil services. So they themselves thought that we need diversification to, like, aspirants or young grads from different diverse fields should come into civil services, because they add extra knowledge, extra wisdom to this field. So when they are themselves are allowing it, they know that it's not a wrong thing to do. It is right and it is correct on your part, and you have to convince them and you have to convey that message to them. So how it is done, it is up to you. You have to do exercise and you have to practice it in the mock interviews. But most probable question is this. Now after this, there are 9 focus areas what I observed from the interview transcripts of the previous toppers. So I kind of interacted with them. I took questions from them. So what I observed is, most of the times, because you are a doctor, they'll ask about what is the abbreviation of MBBS, which medical college, where it is located, what is the peculiarity or history of your medical college, and the hospital where you worked, how many beds are there, what kind of treatments they offer, is there any speciality to that hospital, who is the founder, is there any specific name, like for example where I read it is Gandhi Medical College. So they might ask about what is the importance of that person in this and all. So just focus on about your medical college and hospital, and about MBBS, MD, what are the branches we have and all, about the strength and all, general statistics. Just be ready with them. Apart from that, from medical see, I'm only focusing on the health related part. Let's say you are from Bihar, okay, Jharkhand. Let's say you are from Jharkhand or Bihar, whatever it is. We have Kala Azar, which is endemic there, right? Kala Azar, which is endemic, and there is a national Kala Azar elimination program which is going on to eliminate Kala Azar in 2023-2024. It is very relevant. So if you are from Bihar, if you are from that particular state wherein you have any disease which is endemic, the questions might come up. I don't think they will ask that specific questions. At least they'll ask you what is the major diseases that are prevalent and what is they're doing. For example, if you are from Telangana, Nalgonda district, the fluorosis is prevalent, right? So if you are from the Nalgonda, you should know like A to Z about fluorosis. Or if you are from Bhopal, you need to know about the Bhopal gas tragedy, which is a medical disaster, right? If you are from Orissa, you need to know the floods and how to control them, because it is a disaster, and what is the role of a district magistrate and a medical graduate or a medical officer in that. So these kind of questions might come up if there is a health emergency or health related importance. Like in UP, Muzaffarnagar, there is some incident happened, and recently in Kolkata there is an incident happened. So whatever is currently relevant, if you belong to that place, that question might pop up. So have some medical knowledge of the same issue, because the board will not have the core medical knowledge on the topic, and they don't have an answer for their questions. Okay, they'll just throw random questions on you. If you're sitting in front of them, they might, if you are from that village, they might have read it in the news, and they'll ask you that there was this new disease has come up in Kerala, that Zika virus and all. What is it? If you're from Kerala, you need to know it. And why these kind of viruses are first isolated in Kerala? What is the reason behind it? Is it because of the environmental thing, or is it because of the global travel? So what is the particular reason? So these kind of questions might pop up. Be ready for those things. Okay. And so disease burden at your place of birth, to the taluka level, like to the district level, then to the state level, you have to find out national level disease burden statistics and all. I'll be sharing with all the doctors who are part of interview guidance program. Right now, health and vital statistics, as I said, very important. What is IMR in your state? What is IMR of the India infant mortality rate? What are the ways to curb infant mortality rate? What is India doing to improve the maternal mortality rate, and what is the current ratio? What is the total fertility rate? TFR question has come in prelims, the one which you have attempted. There was a very good question on total fertility rate. Okay, and about contraceptive failure. So what is the contraceptive usage rate? So these kind of health and vital statistics should be on your fingertips. Mostly we refer to National Family Health Survey 5 data, WHO data, and also the PARC latest edition data we refer. And so whatever stat you quote, whatever value you quote, what you need to do is you have to give the reference to make it standardized. Okay. Now, apart from that, yes, wide knowledge on national health programs, national vector-borne disease control program, okay, communicable diseases and non-communicable disease control programs. You can't just limit to the syllabus part. You have to go beyond it and what is happening. Like if you come across any new disease in the current Hindu paper, like whenever you read about that, try to go and see the disease burden and what are all the health programs available for that. Okay, national any change, any new program which is announced by the government, you need to have an idea about that. Now DAF based medical questions, yes, there will be there, like in your hobbies section, in your medal section, if you might like, there is a medals or award section wherein you might have got a certification from a cardiopulmonary resuscitation or CPR training. They'll ask you what are the steps of CPR or how CPR is done. Can you demonstrate it for us? They might ask you these kind of questions. So whatever you write in DAF, anything related to medicine or medical related stuff, like hobbies, if you write I'm foodie, like preparing food. So what is the dietary guidelines or dietary requirements for an Indian adult or an Indian maid recommended by ICMR? So these kind of questions might pop up based on the DAF. So look at the DAF carefully. Is there any medical question which can be asked? You have to do that. So what I am planning is from one-on-one interview sessions which I will be conducting for doctors who have enrolled for interview guidance program. I'm gonna read the DAF in detail. I'll frame some of the health related questions which can be potential from that particular DAF. So I'll ask those personal questions, right? So I'll do that exercise for you if you're part of interview guidance program. So DAF based medical questions, just keep a track of it, right? The health professionals. So what are all the laws available? What is the future of this? Why? What are the reasons behind attack on doctors and how can we curb it? So you also need to mention the preventive measures. One of the current issue which has happened recently, which might pop up in the exam. Okay, and also the current issue is National Medical NMC, National Medical Council has been established, and there's a lot of chaos in conducting NEET PG exam, and a lot of paper leak issues have been there in the medical education sector. You have to tell them the reasons, and you have to tell them what is the ways we can actually curb this. So way forward critical thing is more important rather than having a current affair related knowledge. So these are the few current issues in health sector. Recently for the last 2 to 3 years, they used to drill a lot on pandemic, COVID, emerging viral infections, superbug, what can be the next COVID, and also vaccines part, how a vaccine is developed, what is vaccine hesitancy. These kind of questions were the famous questions, but I think we have slowly moved out of the pandemic effect, the COVID effect, right? So now we are working on the root level issues in the health sector. Just focus on those things. It is it is okay for us to focus on the current issues in health sector. Now, seventh one, critical appraisal of healthcare delivery system in India. A lot of changes happened in healthcare delivery system. Now we have health and wellness centers, that is Ayushman Arogya Kendras. The sub centers and PHCs are modified into health and wellness centers. What are the changes in rural health, urban health? What is the PHC capacity? How many doctors should be? So whatever is related to healthcare delivery system of India, you need to know it. And also why healthcare system of India is failing, what is the GDP, the amount spent on health sector, and what is the latest health budget, and all these kind of information you need to know regarding the healthcare delivery system in India. Now, applied aspects, any medical knowledge, like what will you do? Like there was one question to a previous topper, like one of my family member is suffering with like high BP. Can you tell us the ways to control it? Or there was one question to an aspirant where there was some rare disease, any cancer related disease, it was there, and they suddenly asked it, what is this disease? How can we treat it? Is there any treatment available for this cancer? So they'll ask those personal kind of questions for doctors. There is one question like out of the blue, somewhere there was a question to one of the medical student who attended an interview. What is the function of spleen? What is the function of liver? So pretty basic questions they'll ask you, because like you know in depth a lot of things, but suddenly they'll ask you what is this function of spleen. You might not be aware of that fact. So these kind of questions have been asked in the past, though the probability or chances of asking core medical question is negligible, less than 1%. So don't get into the complete medical science optional books and all, but at least the latest paper, 2024 paper, what you have attempted, just go through the questions and answers of that. Okay. And also in a holistic way, that basic way, what is the function of liver, what is the function of spleen, the body organs, how do they function? Okay. And common chronic diseases like hypertension and diabetes management, what should be done? Okay, how to prevent heart attacks and all, any global data and all, you should be ready. Any cancer related data, cancer is also a major issue, right? So you have to focus on those things. Now finally, medical ethics. See, ethics is an important aspect of your mains. Now you know what is medical ethics also. Like ethical application in the medical field, what is its role, what are mention 3 examples, the clinical cases and all, they might that might pop up, okay, from medical ethics point of view, because you are a doctor. Right? So these are the 9 focus areas that you need to look into. Now the topics wise, as I already told you, current updates, national health programs should be focused, and all the MCH indicators and programs. I had seen in the interview transcripts of you, the toppers, there were questions on program Lakshya, there were questions on program on Janani Suraksha Yojana, there were questions on RBSK. So any, and you know the importance of this mother and child health program, they're also part of prelims for the last 6 consecutive years. Every year there is one question on MCH indicator or MCH program. You know how important it is to kind of control infant mortality rate and MMR. When I say this, you need to know the SDG, health related also. Like whatever you discuss, whatever topic you want to discuss with the interviewer, start with what is the sustainable development goal for 2030. Okay, very important. So you have to by heart or memorize all the health related SDGs. And lot of things going on with breastfeeding. You know how important it is if you are a medical science aspirant students. We have a program, Mother's Absolute Affection program in India, which is going on. Okay, MA program. And also we have a baby friendly hospital initiative. Just be thorough with it. Just go through all the vaccines and immunizations and what is the current national immunization schedule. And as I said, critical appraisal of healthcare delivery system in India. What problems Indian system is facing? Primary healthcare, secondary healthcare, tertiary healthcare, root causes, how to curb them. What are all the programs available to improve the healthcare structure of India? Okay, recently there is a program wherein we are establishing AIMS everywhere, right? All India institutes. When I was preparing for my AIMS exam, only AIMS Delhi was there. Now almost 14 AIMSs were there. So you have to know what is happening with the healthcare delivery system and health education part also. And major diseases in India like TB and other diseases, what is the epidemiology? That is the problem statement. You should be aware of that. And antimicrobial resistance is a budding problem. Okay, what are the ways to curb antimicrobial resistance, which is rampantly going on in the community? You have to be ready with the reasons and ways to curb it. And what are the emerging diseases? And generic medicines is one area where I had seen questions have been asked in the mock interviews, but not in the final interview to the many questions. Like, is there any national health program for generic medicines? How to support generic medicines? Okay, what is an orphan drug? Okay, what is a drug mimic? There are a lot of ways these kind of drug questions might come up, because drugs, okay, generic medicines, affordable medicine is also a part of sustainable development goal, right? Now, bridge course, this is also one area where there are a lot of controversies. Do we allow BAMS, Ayurveda, homeopathy doctors to practice MBBS? And the problem of RMP, rural medical practitioners who are non-registered or unregistered medical practitioners, how to curb that problem is also a budding health related issue. Just focus on that. And as I said, attacks on medical community, health related SDDs. Concept of One Health is gaining importance in WHO. Just go through the concept of One Health. And also any disaster, health related disaster, what is the role of magistrate or medical officer? Okay, if there is a fireman accident, what is the role of a district magistrate? If there is an earthquake, if there is a flood, what kind of diseases can be seen? What? So disaster management itself is I think it's part of your GS paper also, right? So you should be ready with disaster management, and you should add a touch of health to it. Okay, and also waste management is also a community problem. So biomedical waste management. So yes, there is an industrial waste management which you generally learn in environment part of GS. Add a touch of biomedical waste management to it. What are the color codings and all? You should be ready with that. And recent healthcare budget 2024 and problem of drug abuse. Okay, very relevant currently. Drug menace in India. Okay, why there is what kind of drugs? What are the rave drugs? Okay, what are the health effects of these drugs? What are the ways to actually curb this? Okay, cut down the addiction part. Okay, what are the preventive measures? Be ready with this part. And also one latest thing is AI in medicine, artificial intelligence, IT, computers in medicine, information technology in medicine, robotics in medicine is also an emerging field where you need to have a subtle knowledge from the science and tech part of general studies. It is there. So they might ask you, how can you use artificial intelligence in medicine? Okay, mainly in the radio diagnosis part, a lot of research is going on. So what is AI in medicine? You have to have a fair idea about it. Now, DNA fingerprinting, yes, it's a technology. It's forensic medicine based application of health. So in any forensic medicine, they might ask you. Okay, and also recent bills, whatever amendments have happened with health related, like MTP Act amendment happened, DNA bill amendment happened. DNA bill is now removed from the parliament. Don't worry about that. And surrogacy bill, which was recently introduced. Just go through the recent bills in medicine. Finally, the nutritional programs, Anemia Mukt Bharat, Poshan Abhiyan, and what is the global health index, and what is India's rank, and what is the controversy surrounding GHI, because the world portrays India as the hunger country, right? So there are a lot of controversial discussions between. So don't get into the controversies. At least understand the basic of what is GHI and what is our rank, and what are the ways we can kind of improve the nutrition in the community, nutritional measures, nutritional programs. Anything related to nutrition is important.
UPSC MEDICO is now launching interview guidance program for doctors for the year 2025. As you march towards your final step in UPSC journey, better performance and personality test is crucial for medical students, right, to gain edge and to get into top 100. The mere fact that you're already in a noble profession definitely holds a positive bias during this personality test. And now it is time for you to capitalize on that with special focus on learning health related topics in a preventive way. And public health is crucial for a personality test. And the main focus area of this IGPD program is we will be discussing all health related topics. Yes, it is a hybrid program. There will be live discussion and access to recordings will be provided if students want to learn on at their own pace. For all the discussions and all the health related topics which I have already discussed in this video, we will be giving handouts. Major focus is always on health related statistics. Now you have national statistics and also state level, right? So if you hail from Haryana, let's say, me and my team will help you in segregating the health related statistics of that particular state, and we'll also include that in the mock interview which we are going to conduct. Okay, there is a special one-on-one mock interview session by me which is purely DAF based, and special focus is on public health related and medical aspects. We'll also provide personalized mentorship for interview going students. There will be special live interaction with previous year topics. Last year we have brought in three toppers from top 150. So they have shared their interview tactics and their preparation strategies. So this year we are trying to bring in more. So you will have access to these special live interactions wherein they will provide interview related guidance and also their experience. Now, apart from that, we are also planning this GDs, that is group discussions. Group discussion is the place wherein you will learn to communicate, and also you will come over this communication anxiety, and you'll put forth all critical analysis points with the help of the discussion. So we are trying to plan that as well, the periodic group discussions. So for that I need quick enrollments, early enrollments, and also good sample size, so that different perspectives can come from various aspirants on a single public health issue. So the major focus, as I said, this interview guidance program will be focusing on the public health issues, because for any doctor, you see, not only for doctors from medical science optional background, they are the major chunk. There are few doctors who hail from other optionals as well, like sociology, anthropology, geography, etc. For them also, because your DAF contains MBBS or any medical science related degree, the board tend to ask you personality test questions related to your profession, right? So for them also this is a boon, because you might have forgot health related aspects, because you are more generalistic now if you haven't opted for medical science as your optional. So you will also get benefit from this plan, because last year two of the students from different optional also were part of this program, and it was really helpful for them as well. Now, apart from that, the topics which I have already told you are these topics which I will be majorly focusing upon: the current updates of all national health programs, health statistics, the major disease burden in India, the vaccine and immunization status, antimicrobial resistance, a budding issue, yes, superbug and emergency infections, generic medicines. So, a lot of questions in the last year personality test are from generic medicines. So, all these topics are actually a gist of whatever I have collected, the information I have collected from last year toppers who have attended interview. Okay, so from their questionnaire I have collected their all the questions which were asked related to medical science. Based on that I have segregated these topics. So all these 16 topics that I will be majorly focusing upon, we'll be adding few more topics based on the development, because interview process is long. Like interviews will somewhere start from end of the December to January, and they'll continue till April last year. So for that reason we will be like based on your interview date, we'll personalize your schedule, and we'll schedule mock interview very close to your final interview date, so that we cover a lot of major happenings in these couple of months or 3 months. It depends upon what is your interview date, the final interview date. Okay, so we'll take a call according to that. So this is what is interview guidance program. It's a paid program. I'll share the details in the link below. Okay, you have to, if you wish to enroll, you have to fill the form. Okay, my team will reach out to you to help you further, and once your enrollment is successful, you will be added to a separate IGPD 25 groups, WhatsApp and Telegram, wherein we'll be sharing all the relevant content, data, program, live interactions. And in this I also want to include the mock interviews, one of a few of the best mock interviews of last year aspirants who have enrolled into this course. I will share those as well for reference, because I think in the YouTube in general, you will not find any public health related mock interviews. You will see the mock interviews of the toppers from various institutes, which are majorly focused on social issues in the public domain. So health related issue mock interviews, I have a compilation of these. I will also share those recordings with you. I will also share All India Ranker live discussions of last year's also, because this current year I will be talking to few of the toppers. We'll arrange some live sessions with them as well. But the previous year toppers from 2020, 21, 22, 23, I have some recordings of their personality test experience and their tips about personality. I will also compile the videos and I'll share with this. So there are a lot of things that I'll be taking care of in this IGPD program. So you don't have to worry much about the medical science optional or any questions related to MBBS or public health. So your job is to focus on the general interview part or general personality test part. If you are part of this program, which I really recommend you to go ahead and enroll, then you will be given all these content, so you don't have to waste time in segregating them. Everything is ready made, okay, on table, so that you can kickstart your preparation as early as you can. Okay, so all the best for the next step. So see you there in the IGPD 25 program.